the isolation period was one that the CDC issued last week. They have certainly received feedback and questions about the role of testing in shortening that quarantine period, and they're actually working right now on issuing a clarification on that. I would expect that any day now.
All right, joining me now, we have Dr. Chistopher Colbert. He's the Assistant Program Director of Emergency Medicine Residency at the University of Illinois. Dr. Colbert, always a pleasure to have you back, sir. So I want you to break this down for our viewers, including myself, right? What are the symptoms of Omicron on a vaccinated person versus an unvaccinated person?
So the presentation, vaccinated versus not vaccinated, does not change. It's the severity. A great question and very commonly asked. So those patients still present with fever, flu-like symptoms, runny nose. However, what we identify clearly now that was not as prevalent before is that with the Delta variant, we identified a loss of smell as well as a loss of taste, where that is not as prominent with the Omicron variant.
Dr. Krober, do you think the mild symptoms of Omicron is downplaying the surging cases that we're currently having and the actual impact this virus is having on people?
I do, 100%. Defining Omicron as mild does not decrease the caseload that we see in the hospital, nor does it increase the positive patients that are coming to the hospital or seeking medical advice and medical management from different facilities. And I think that's a huge aspect for all of us to be cognizant of, is that this is still COVID. It's still COVID. It's still spending a lot of time in triage, patients, as well as hospital beds. And it's something that we need to take seriously to move forward.
All right, Dr. Colbert, I want to ask you a question, right? Israel, I think we've had this conversation. I'm sure if we have, but I know you know this. They're already administering a fourth shot to their older population, including healthcare workers as well. We had a chance to actually ask CDC Director Dr. Rochelle Walensky, would the U.S. be following those steps? She said not just yet. More data needs to come out in terms of how these vaccines are helping us. But folks here in the U.S. are getting fourth and fifth shots. Is that dangerous? Are they jumping the gun? Or are they just protecting themselves? What does it mean?
So unfortunately, there's a small group of individuals that are falsifying information to receive additional boosters. And I think it's extremely important to comment that there's no strong evidence at all that an additional booster will enhance effectiveness of protection of immunity. There's just no clear data. And for those individuals that are receiving these additional boosters, remember that this shared responsibility, we are trying very hard because right now 61% of the adult population are fully vaccinated with boosters. So what we're trying to do is ensure that these are accessible to the other 40+% that really need to see the vaccine and the booster as well. So keep these things in mind and remember that at this point, there's no clear evidence that a second booster is going to enhance immunity.
Okay, so basically, you shouldn't consider an additional booster. That's what you're saying.
Exactly. Right now, there's absolutely no indication to receive or seek information or to receive a third or fourth booster. There's absolutely no reason at this point, and there's no data that shows any benefit from that either.
Okay. All right. We're about to enter the third year, right? We've already done 2 full years in this pandemic. I believe it was like mid-March when everything started shutting down. What concerns you as now we're dealing with Omicron? God only knows when the next variant will pop up. It's just a matter of when, right?
The biggest concern I have at this point is the fact that the fatigue is showing on medical staff. So as opposed to last year when the hospitals were really packed and the beds were packed and the triages were packed, we had nurses, we had staff. So now we're going around this Robbins barn one more time with the same patient population, specifically those that are unvaccinated, and that they are draining the resources in hospitals and beds, but also the patients and the frustration of nursing staff and hospital staff. So that's a huge challenge. And if we continue in this path, it will still drain from that specific resource of not only medicine, but also in hospital staff. So it's my hope that we get things together, is that collectively there is a shared responsibility for everyone to do what they can so that we can all move forward and accept and work with our new normal.
Yeah. What does moving forward look like? Because the pandemic seems like it's going to be around for a long time.
This is going to be around for more than just a long time. This is going to be around for some time. And
What does that
it
mean, Dr.
means that we
Colbert, when you
adhere to
say for some
recommendations.
time? Do we need to learn to live with COVID?
100%. It's the same way we learned to live with the flu, the same way we've learned to live with different viruses as well. Viruses aren't designed to become extinct. They're designed to have variants so they can sustain themselves. However, what we do is we have a means of, and specifically vaccinations, to manage that. Vaccines are not a cure. They're just a means to decrease the severity for those patients and decrease the admissions. And that's a realistic and honest goal. And if we adhere to those and abide by guidelines, wearing the mask, and everyone receiving these vaccinations, we can move forward so we don't have this surplus of patients that really, really clog and put a strain on the health system. And that's what moving forward is managing what we can in the collateral damage so it doesn't have such negative and ripple effects as it has today.
Yeah, Dr. Colbert, my last question, and then we got to go. You already mentioned that healthcare workers, you're starting to see the fatigue on them, just complete exhaustion. What does the next few weeks or months or years look like if you're saying we now have to learn to live with this virus? How are they going to handle this?
Everyone's trying to do the best we possibly can. And there's developing ways of not only just seeing patients, but just in educating our young medical staff. This is affecting students, residents, and their ability to see patients for individuals to have elective surgeries. In Illinois, in fact, we have called off all elective surgeries so to decrease the exposure to hospital staff for those individuals who have the virus and are testing positive. This puts a strain on the education system. This puts a strain on the healthcare system as well. And we're adjusting and making modifications so that we can move forward and still teach, still have residents, still have attendings, and those individuals maintain their resilience while seeing patients. So it's an art in progress. And again, with having more conversations such as these, we can move forward and in a positive direction.
Yeah, well said. It's an art in progress because, yeah, we're all trying to learn this dance together. Dr. Colbert, thank you for joining us, sir. It was a pleasure, and Happy New Year. Straight ahead, more ways the pandemic is impacting our lives. Schools now adapting amid the current surge of COVID cases and as learning resumes across the country, how they're doing it. And also, we're still waiting on remarks from the White House. When President Biden meets with members of the White House COVID-19 response team, of course, we'll bring it to you live right here on BNC Live.